Welcome back, everybody, to IPHA's Interprofessional Health Talk, which is an interview series focused on showcasing interprofessionalism through insightful discussions with various professionals and students within the health sector. We hope to expose students to different career paths and skill sets so that they can make a more informed decision about their future. My name is Jenna. I'm solo today. I don't have a partner, but that's okay. Our guest today is a registered midwife who practiced for 10 years. Her practice led her to notice recurring issues in maternal and postpartum services, which led her to take matters into her own hands and start her own business. Welcome, Althea. It's so great to have you here.
Thank you so much for having me. I appreciate your time.
Of course. We're looking forward to hear everything you have to say. To start, could you talk about what midwifery is?
Okay, so midwives in Ontario, so I only speak to Ontario because it does vary a little bit from province to province. It varies a lot in the United States. So I'm just speaking about Ontario midwifery, so I'll put that in context first. So midwives are primary care providers for low-risk healthy pregnancies, birth, and postpartum. So basically when you're pregnant, you have three options to either see a obstetrician for your prenatal care, a midwife, or if you have a family doctor that does obstetrical care, then you have that option as well. Not a lot of them do it, but some of them do. And so midwives are sort of one branch of that. So it's for low risk, normal, healthy pregnancy. So if you don't have any underlying risk factors, anything that puts you in a higher risk category, then you can go with a midwife.
That's really interesting. So how do you become a midwife in Ontario? Because that's what we're focusing on.
Yeah, so midwifery is actually an undergraduate degree. So you get a Bachelor of Health Sciences in midwifery, and there's actually three schools that offer it. So Ryerson, Laurentian, and McMaster are the three programs. And
how different was the application of it compared to you studying it? Do you get what I mean?
Yeah. It's by that time, like the application is pretty similar. The only difference is like, in all healthcare training, at a certain point, like you can only do so much on the textbooks or, using the fake IV arm. Eventually you get to the point where you need to start doing it on people. So for me, that was kind of the biggest like jump in care. And that was a hard part for me as a student because I'm like, I don't like to practice on people. I don't I feel bad if I make the wrong decision or do it wrong, where like, that's just a leap that you have to take. And then the other piece of it is that you're always working as a student under somebody else. So it's technically you're working under their license. So as much as you're managing care on your own by the end, you still kind of have to have in your head, okay, what would my preceptor do in this situation? And once you're alone, you don't have that anymore. So there's that sort of freedom, whereas you can just kind of go with your own plan and you're just like, okay, I've got this. This is what I want to do. You don't really have to second guess yourself, which I think happens a lot as a student. But the actual skills, like hopefully by the time that you are practicing, you kind of feel a little bit more confident, but to tell you the truth, like you don't feel 100% confident. And that's, like I said, why you have that kind of extra mentorship. And actually the first couple of births, you usually have another midwife that sits there with you the whole time.
Changing gears a little bit. So there's often an intersection between business and health, and you've exemplified that because you're the founder and CEO of Womb&Wellness. So could you talk more about how and why Womb&Wellness was created?
Sure. So I'll just briefly start with, so Women-Wellness is a maternity services network. Basically, the goal is to connect people with the support and complementary care that they might need throughout their pregnancy journey. So everything from, pregnancy planning, pregnancy, birth, and postpartum, we have those complementary care providers that have a special interest in that care that can work along with people. And that I found there's kind of that gap where people don't really know. So everyone knows, like you get pregnant, you'll have a primary care provider. But then there's a whole bunch of other people that can kind of help you along the way. So there's fantastic, prenatal educators, there's chiropractors that have a special interest in this care, naturopaths, so a lot of people that really kind of can give you that holistic, complete care.
Kind of shifting a little bit, how has the way by which maternal and postpartum services provided, how has that changed because of the pandemic, or has it changed?
Yeah, certainly it's changed. I guess I'll start with the good.
Okay.
The good is that healthcare has sort of been forced to evolve. Healthcare is just in general very slow moving, and especially obstetrical care, because nobody wants to test or change anything when you're working with pregnant people and babies. There's a lot of liability there. So things move very slow, and there's just like things are done a certain way just because they've always been done that way.
Mm-hmm.
It's very slow for change. And so I feel like this pandemic has sort of forced some changes, like more access to like telehealth and virtual services,
Mm-hmm.
and for the providers to be able to do their work that way and still bill for it, which I think is important. I think there's a really slow adoption for that sort of thing, but it really does fit because a lot of healthcare is just a transfer of information.
Talking about the different services that you put on the website, maybe we can talk more about the different professionals that are involved in maternal and childcare and postpartum services and all that lovely stuff.
Absolutely. There we go. All right. So basically, and as I've spoken about a little bit, your pregnancy journey, there's pre-pregnancy, pregnancy, birth, postpartum, and then of course, your care kind of continues beyond that. Mm-hmm. But just want to talk a little bit about kind of who you might interact with during these times and the different care that's available. And I'm just going to say before I forget, so like there's something that I'll mention during, pre-pregnancy, but these services you can continue using during pregnancy and postpartum and all that sort of stuff as well if I forget to mention it again. So, all right. So some people plan their journey. Some people go through fertility issues. Oftentimes the start would be, especially if you're planning, maybe you want kind of blood work done just to see where your starting point is, or if you're having fertility issues, you'll start with your family doctor. And so they can kind of do the general blood work, ultrasounds, whatever is needed, before then referring you to a specialist. So a fertility specialist, oftentimes they're obstetrician gynecologists, who you would go to if you're kind of looking through a fertility journey. But then kind of the things that people maybe don't think about in their care at this point is the complementary care. So that's like naturopath, traditional Chinese medicine doctors, fitness and counseling, mental health, all that sort of stuff. Like pre-pregnancy is a great time to kind of build those foundations because that's where you really want to optimize your health. And naturopathic care, TCMs, like they're really great at looking at the whole picture and just giving you kind of lifestyle, everything from diet to different modalities, maybe like acupuncture and that sort of thing that can help enhance your fertility and also just help you be as well as you can moving into this process. And then similarly, fitness, like I come from an athletics background. And so I really feel like pregnancy and birth is like an athletic endeavor. And so and we all know there's studies saying that exercise in pregnancy is recommended. And it's definitely kind of hard to start those things when you haven't done it outside of pregnancy. It's done, possible, and then people absolutely do it. But I think it just kind of sets yourself up better for success. If you kind of add these things in before you're even pregnant, if you're planning and you've kind of set out that path, these are definitely great things to add in. And then mental health is a huge, huge thing. 1 in 7 people are affected by mental health issues during pregnancy and postpartum. And so, especially if you're at risk or you already have mental health issues, definitely want to make sure that pre-pregnancy, if you can, to kind of set those foundations, make sure that you have your therapist or whatever it may be, so that you can have that care going forward into the pregnancy and postpartum.
Yeah, that makes sense.
And then when we move on to pregnancy, so like I said before, you're usually going to start, so you find out you're pregnant. Oftentimes people go to their family doctor to confirm that, and they usually will do your kind of initial blood work and ultrasounds. They'll kind of sometimes do that whole gamut of stuff that's normally done in early pregnancy. And especially if you're planning to go with an obstetrician for your prenatal care, it's important that you see a family doctor first because you need a referral. Whereas with midwives, as soon as you know you're pregnant, you can actually just call. There's no referral needed. And that's around billing issues. For specialists, like an obstetrician, they're a specialist. They need a referral to be able to see you, and they bill separately for that. And so that's why you need to see a family doctor first. Whereas midwives, they're paid per course of care. So we just get, once, we've seen a client since they're pregnant all the way until 6 weeks postpartum. And then after their whole care is completed, we get one lump sum that doesn't vary depending on what we do. So it's a very different course of care. And so we don't need referrals. So as soon as you're pregnant, you can go ahead and just call a midwife, go online, fill out their intake form. Or if you have a family doctor that does obstetrical care, then that's another great option as well, because that's already somebody that you have a relationship with, that you know, and then they continue with your prenatal care. So with midwives and family doctors, like I said, limited scope of practice. So family doctors do have, obviously, like just your regular medical stuff they can handle, but if there's certain higher level obstetrical issues, they might still also refer you to an obstetrician for your care if need be. But those are kind of your options in terms of your primary care provider. If you have some sort of high risk thing, then you might have other doctors involved in your care as well, maybe an internist or a rheumatologist or whatever, like if you have an autoimmune disease, something like that, then maybe you have continued specialists that will work with you throughout pregnancy as well. And then kind of to add in the complementary care. So like I said before, all the stuff that you started before, so maybe you started with a naturopath or a traditional Chinese medicine practitioner, your counseling, your fitness, all that stuff can continue in pregnancy. And then there's also other providers doing great work and that I recommend for everybody. So physiotherapy, not something that people immediately think of during pregnancy, but physiotherapists are great, especially ones that are trained in pelvic floor physiotherapy. This is like one of my things. I'm like, everyone should go and see a pelvic floor physiotherapist. If you don't know where your pelvic floor is, it's holding up everything. It's, you know, the muscles there. Baby's going to come through the birth canal. So that area deserves some special training. Doing a lot of extra work during pregnancy, during birth, and postpartum definitely needs recovery. So it's great to start your relationship with a pelvic floor physiotherapist. They can help prepare you for labor and learning how to connect with your pelvic floor, relax those muscles when you need to, which is needed for pushing. So it's actually a really great, and they do fantastic work. And it's something that I encourage everybody to do. And then there's also like chiropractic care, massage therapy. So obviously chiropractors are associated with back pain, definitely can help with that. But once again, like I said, it's that holistic care where they kind of look at everything. So maybe there's stretching, maybe there's posture, there's that sort of stuff that they can help you with as well. And then massage therapy, people are pretty familiar with, prenatal massage, which can definitely help with relaxation, sore muscles, fluid retention, because there tends to be some swelling in pregnancy, all that sort of stuff as well is really, really helpful. And for some people, it might not be all of these things, and you don't necessarily need it right away in your pregnancy.
The next question that I have is, looking back at your career, what are the challenges that you faced?
Oh, it's a stressful job. Midwifery is a stressful job. I think for myself, I never lost sight of kind of the liability of it, and that I have, 2 lives that I'm working with here. Mm-hmm. And that always kind of weighed on me, is that I just need to make sure I'm on my game. And, people page in the middle of the night, and you do all these assessments, and sometimes you don't actually need to go and assess people. But even when I make that decision to not go and assess people, I still think about it. So I'd like to go back and just sleep well. It's like, I'm thinking about, okay, is it the right decision? Are they doing okay? And all that sort of stuff. So, there's a kind of just that regular healthcare provider stress that I think that any primary care provider feels. For me, the on-call lifestyle of midwifery is just 24/7. It's just all the time. And so it's hard to kind of carve out that time for yourself or for your family. And in particular, just like birth tends to come in clusters. So maybe you have like a week where you don't have any births, but then you have a week where you have 4 or 5 or 6, and it's just one after the other. And so just definitely kind of being able to work properly and work your best after, being up for 24 hours, you go home and you sleep for, 6 hours maybe of bad day sleep, and then you're back, kind of finishing that same birth or with somebody else for, potentially another 24 hours. And it's tough. It's tiring, and it's just hard to be able to, like, for me, I never wanted to be sacrificing people's care because I'm too tired to be able to do it. But at the same time, like, it's my client, I want to be there, and you don't want to be putting that work on your other midwifery team because you need to go sleep or whatever. And so it's that hard to find that balance. And so I think those are kind of the most challenging things for me, just kind of the on-call lifestyle and that sort of thing, and keeping that balance.
Looking into the future, and with what you know now, what would you hope your future self works on?
Oh, well, I guess I hope success in this business, just because I think it's important. Not so much like for myself, that this is not not something I think is going to make me rich, but this is something that I think is going to change people's lives. Like, I think just kind of continuing to get the word out there and continue to get people that can make those decisions, like government and people higher up in the hospital, just to understand the needs kind of on this maternity care spectrum is very important to me. So I definitely want to just continue chugging along. I know everyone keeps telling me in the business world, like, it's the hardest thing that you can do. Like, it's, most of you are going to fail. Yes, it's constantly grinding, constantly hustling. And I just want myself to persevere so that we can make that bigger impact in maternal health. So that's the main goal right now. So just sticking with it and just keep knocking on those doors, just to get the word out there.
Yeah, perseverance. And I'm sure you've built that skill up through your clinical practice as well. So that's great.
I have. I'm working, but it's constant. It's a work in progress, always. Something that you can do.
Yeah, well, that's a good thing. Life would be boring if it was just like, that's it, I'm done. Those are all my questions. Would you like to add anything else, or?
Oh, I think we're good. I think we covered a lot. This is more than I normally talk. So
Yeah, no, I'm going to rewatch this because there's so much really, really interesting information and I want to like research at the same time. So a lot. And I think this is like timeless information as well. Like, it's going to be relevant like 20 years from now as well. So thank you for that. And Althea, thank you so much for taking the time to talk to me today and for this conversation and for all the information and shedding light on issues as well. And thanks everyone for tuning in to another episode of Interprofessional Health Talks. We'll link Althea's website in the link below, but it is Womb and Wellness. And yeah, have a wonderful week. And you can follow us on our socials at UAutoIPHA. And thank you so much, Althea. Have a wonderful day.
You too. Take care.